The Health Secretary Matt Hancock has announced a local lockdown for the North East after the concerning rates of infection within the region. Local council leaders had written to government ministers after the dramatic increase in positive coronavirus cases. Newcastle City Council's Director of Public Health has discussed the new restrictions.
Since the lifting of lockdown, Newcastle has really done very well. We saw a low level of COVID cases for a good number of weeks. But we then began to see a rise in cases and an increase in the amount of spread of the virus that was happening amongst young people. This week we've begun to see another change, and that is an increase in the number of cases in older people as well. What we've asked for is a number of changes that might be made to the way that businesses operate, to the way that people mix and mingle socially, the way that we support businesses who are going to be subject to some of the restrictions that we're asking to be put in place, which will include earlier closing, table service only, and no congregation at bars or outside takeaways late in the evening. I realise that this is very difficult. People have been through a lot already, and we're trying to tread a line between preventing the virus from spreading and all the damage that that would do, and the penalties of a major lockdown with its limitation on people's earnings, their ability to interact socially, the loneliness that it imposes on people, and all of those problems that impact on their health, well-being, and on the economy and the way that we live. We're trying to get it right, and it will take us a while to get the balance right between those different parts of protecting the public and trying to guarantee the maximum freedom that we can to the maximum number of people. This is the right thing to do, and if we act quickly, we have a greater chance of an effective curtailment of that increase in the virus and a better chance of getting back to normal as soon as possible.